Okay, so I live in one of the zip codes with Legionnaires Disease.
Uh-oh.
So Brian knows. I don't want to talk about the specifics, but I've been dealing with some other health stuff, and so I've been having some body issues going on, and then
You got a lot going on.
I got a lot going on. And then this week, my downstairs neighbor, I bumped into her. She had Legionnaires disease.
Damn.
She's a smoker. She's a bit older. She might be in like her 60s. I don't know. With black people, like sometimes you can't tell like how old she is, but I think she might be in her 60s. And she's a smoker, so she got health issues. So then I started feeling sick.
It's not contagious, by the way.
Yeah, but it was in our building. So
Yeah.
I'm thinking like if she had it and she's in our building, I started feeling sick. I had a bad cough. So I'm thinking I already have my other health body stuff going on. Then I start coughing and I'm like, bitch, if I fucking got Legionnaires disease.
It's just all
And then they
bad.
put this sign on our building door and it was like, if you start coughing, go to the hospital.
But mind you, the hospital was one of the contamination
Yeah,
areas.
it was like one of the water towers on the hospital.
Yes.
The like STD clinic in Harlem. It was
So,
like that one.
it ain't safe nowhere in
Well,
your
no.
neighborhood.
Well, also like I told you last week I had started that new job. So my healthcare doesn't kick in until September 1st. So I had started coughing and I read that sign on my door and it was like, if you cough and go to the hospital. And I was like, it's either I'm dying of Legionnaires disease or I'm going to the hospital and I'm getting a $20,000 medical bill.
ma'am.
And I was like, I think I'm just gonna die.
You just gotta take that.